Welcome back to my channel. In today's video, we're going to discuss tuber blockage in women. Tuber blockage refers to the obstruction of the fallopian tube that prevents the egg from traveling from the ovary to the uterus, and it could also be as a result of several factors. Causes of this tuber blockage, as we want to discuss, include pelvic inflammatory disease. This is often as a result of untreated sexual transmitted infection or as a result of chlamydia or gonorrhea. They have endometriosis. This is associated with scarring or obstruction of the tube as a result of adhesions. They have also previous abdominal or pelvic surgery, especially those surgeries that involves the uterus, the fallopian tubes, or the ovaries. And we have also ectopic pregnancy. This can damage the fallopian tube and then cause obstruction. We also have those who have done sterilization, that is female sterilization. It's a permanent form of family planning surgically. They also have cases like surgery, done in the tubes. You can have surgeries like tuber ligation reversal. Some people have come, okay, let us trying to do a female sterilization, and they regret and want to reverse the tube. So that surgery of reversing it can equally lead to blockage of the tubes. So these are the common causes of tuber blockage. Now we're going to talk about the symptoms, what the patient complains about in tuber blockage. Most often, these patients do not have symptoms. But however, those who have symptoms, this could include a result of infertility, that is inability to conceive. This is most common symptoms that they come with. And then you can have something like chronic pelvic pain. You can also have something like pelvic pain or abdominal pain, especially when this tuber blockage is a result of infection or as a result of endometriosis. Then we also have painful periods or painful sexual intercourse. These are the symptoms that could occur if the female has tuber blockage. Then how do we diagnose it, this tuber blockage we are talking about? Several tests could be done. We have imaging tests like what we call hysterosalpingography. This can delineate the outline of the cervix, the womb, the fallopian tube. If there are blockages, the dye will not overflow into the peritoneal cavity. We see point of blockage of that tube. Ultrasound can equally be used, what we call sonohysterography, saline infusion sonography. This is use of ultrasound to find out where there is tuber blockage. I can have endoscopy. We're using laparoscopy, whereby the telescopic minimal access surgery, where you can see directly where the tube is blocked. Then chlamydia antibody test could be done, especially those who may have tuber blockage as a result of chlamydia. So what are the treatment options for people that have tuber blockage? The treatment option ranges from laparoscopy surgery, whereby laparoscopy is used to, you know, deal with the area point of obstruction of the tube, and then can also do tuboplasty. This is just reconstruction of the reconstructive surgery of the tube. You can also do salpingectomy, in other words, removal of the area of the tube that is bad, and especially those who are going for IVF. Then you can also have in vitro IVF, in other words, for those whose tubes, the two tubes are blocked, and there is no other way to help the patient through any treatment option. Other approaches to the treatment of tuber blockage involve something like natural approaches and lifestyle support. With natural uh, approaches, we can't physically unblock the fallopian tube, but they may support reproductive health and other, and then reduce inflammation. So have what we call inflammatory diet, anti-inflammatory diet. These are foods. This focus on fresh foods, vegetables, some like whole grains, nuts, seeds, lean protein. These ones will help to reduce inflammation and support healing. Then we should avoid food like processed food, excess sugar, trans fats, and dairy products that are patient is sensitive to. Also include something like omega-3. Omega-3 is found in fish oil, found in flaxseed. The person can take turmeric, cumin, and then ginger. Then we have herbal remedies. Whenever a patient want to take herbal remedies, which is very common among Africans and Asians, it's advised that that patient should always consult a professional doctor or a professional herbalist. We have under the herbal treatment, we have something like a Don Quai. This supports the circulation in the reproductive system of the female. You have the golden seal. This is a natural antibiotics that also fight inflammatory process, in the fallopian tube. And have castor oil packs. This can be applied to the abdomen to improve circulation and lymphatic drainage of the fallopian tube. Then we have other forms of approaches like fertility massage, which we call Mayan abdominal massage. This can promote blood flow to the reproductive system, may help reduce adhesions and inflammation. And then we have the acupuncture, which is this one is a Chinese traditional form of medicine. It's used to balance energy and to improve uterine and fallopian tube health and circulation. So these are various approaches as regards the herbal treatment forms of the fallopian tube blockage. We have medical treatments. Under the medical treatment, you have tubal recanalization. This is a non-surgical method. It will involve minimally invasive procedure using a catheter to open up the blocked tubes. If the tube is blocked proximal, that is at the near the tube that is very close near to the uterus. Then this can often be done under imaging guidance. That is, you must have something like a ultrasound or fluoroscopic study where you can see how the tube is going into the fallopian tube, and this also achieve a very high success rate for certain type of blockage. Then we have laparoscopy. Laparoscopy is just an endoscopic form of treatment, whereby it's a surgical method actually to diagnose and treat the tuber blockage. And then this is commonly used uh, everywhere in the world now. You can remove scar tissue, can use it to remove scar tissue, endometrial implants, or cyst, all those things that causes tuber blockage. They have tuboplasty. Tuboplasty is nothing but a repair or reconstructive surgery of the tube. It is used to open and repair damaged tubes. They have in vitro fertilization. This method, bypassing the fallopian tubes altogether. If you don't want to start anything dealing with the block tube or anything, just bypass it. And it's ideal if the tubes are severely damaged or the surgery has failed, despite all efforts to succeed, whether surgically or medically. Then, then when do we consider surgery? That is, when do we say we want to use surgery to deal with this block tube, or we are going to do in vitro fertilization, that's bypassing the tubes. One, when there's mild to moderate blockage, the laparoscopy surgery or the canalization might work, like I said earlier. Then if it's severe, the severe or both tubes are blocked, then we can do IVF. IVF may offer a better chance of success. Then you have hydrosalpinx. That is, hydrosalpinx is nothing but fluid feed block tubes. This may require tuber removal before IVF to improve success rates. So thank you for watching. Subscribe, like the video. Please stay safe and healthy.